Hi, it's Georgia, and today I'm making another video about Mental Health Awareness Month. So, to get this conversation going, I just wanted to sort of share my perspective on mental health in quarantine with coronavirus, etc. How it's affected me, and most importantly, though, how I'm going about addressing those problems in the most productive ways that I can, and hopefully share some resources or tips that other people could implement as well. But yeah, I just think it's really important, especially right now, to be talking about this and have an open conversation and be sharing the resources that we found useful, since a lot of us have had really upset routines, daily routines, mental health routines, limited access to resources, and new triggers. So yeah, I'm gonna just share whatever I have to say, and I hope that someone can take something away from it. So my experience with coronavirus shifting my routines. So I was actually studying abroad for the past for 7 months. It was planned to be 9 months, but I had to leave early because of borders closing and confinement, etc. So I was studying in Western France for most of the year. So for me, I had grown really dependent on a group of really amazing people that I had been with, really amazing friends. And I had used them for a really big amount of my support. And so being very suddenly ripped away from them and not really having much waiting for me back home, in terms of support system or friends or just that same type of conversations that we were having in France, that was really hard for me to come from a place where I was discussing my mental health very openly on the daily with people that I felt really understood me, to a place where I felt like I didn't really have much waiting or many directions to turn. So I know this is not an option for everybody, but I got a therapist and I've been loving seeing her. It's been really useful for me. But I know that a lot of people are also not able to see their therapists in person, and that taking calls from the house or not being able to afford a therapist can be also a really big problem. So it's not a super accessible solution for everybody, and I get that. But I think that definitely finding some sort of outlet, whether it be a therapist, counselor, friend, family member, if you have maybe a religious affiliation, maybe finding groups related to that, just finding any way where you can freely express how you're feeling and where you feel comfortable and safe has been really important for me and has helped me to deal with a lot of change in my life. So I would definitely suggest that to anyone. Also, I think that a lot of people are probably having issues with being so isolated and having so little distraction. And so for me, this is obviously not much of a stand-in for real social stimulation, but I found it really nice to tune into a lot of the free Zoom calls that are happening, whether that be musicians that you're interested in doing free concerts on Instagram Live or Zoom, or I recently went to a stand-up comedy Zoom class that was really funny, or just seeing what your celebrities that you care about or public figures that you care about are offering freely and ways that they are trying to continue entertaining people is a good way to sort of schedule in some, number one, schedule an event into your day so that you have some structure or something to look forward to, and also a way where it feels like you're sort of engaging with other people in a sense. It can kind of take the edge off of the loneliness, I feel like. Another thing that's been really important for me, I love lists. I am such an organizer. So my sister has a Diane List of movies and cult classic films that she wants to get through, so I have really enjoyed being able to physically take off movies from that list instead of just scrolling through Netflix until I find a film that looks good. It's nice to have something that feels like I'm accomplishing something even when I'm accomplishing nothing. So yeah, listing out movies that you want to watch, or maybe albums that you want to listen to, or books you want to read, just listing out the media that you want to consume, so that way as you are consuming probably more and more media, having so much downtime, you feel like it is things that you are interested in and have pre-decided that interest you and you would benefit from consuming in some way. and also it feels like you're accomplishing something, so it's been nice for me. Also, this is a self-explanatory one, but I'm a total proponent of journaling. I will never stop telling people about it. You've probably heard a million times, but I love keeping a journal. I think it's really helpful to sort of get the thoughts out, so I'd recommend doing that. And, it doesn't have to be stream of consciousness, it doesn't have to be whatever. You can just journal, like your to-do list for the day, or your tasks, or just write down like your emotions that you're feeling. There are a lot of really creative ways to journal and personalize it to cater to your needs, so I really recommend that for anyone. I think also, and this is a tricky one, it's been a tricky one for me, but exercising is really important, spending so much time indoors, but I know that can set off a lot of triggers for certain people with different relationships to eating, exercising, and body image. So I think that for me the best solution to that has been doing low intensity exercise, and also when possible doing it with a group, so whether that be like a call or like you scheduled it with a friend, or I've been doing things with my sister, just to have that sort of added element of like, this is enjoyable and this is something that I'm doing just to feel good, instead of making this like all in your head. So yeah, these are the tips that I would recommend. If you have any additional tips, feel free to comment them below. If you are looking for any guidance or other resources, there are so many online. If you just look out for it, and I really hope that this helped to some extent. Thank you so much.